Okay, so I'm going to be doing my newborn assessment today. I'm going to review the birth history in the chart. I'm going to go into the room, talk to the parents a little bit about the birth history. I want to maintain privacy, dignity, and safety throughout the exam for the baby. And I want to be talking in a language that the parents will understand. So I'm going to introduce myself, perform my preliminary actions, wash my hands, and then to get started, I'll talk to the parents a little bit about the birth history, and then start with my vital signs. So for respirations, I'm going to put my hand on the baby's belly and count respirations for a full minute. And then I'm going to use my stethoscope and listen to an apical pulse for heart rate, and that'll be for a full minute as well. And then I want to get an axillary temperature, is the most common way to obtain temperature. And blood pressure we won't obtain if the first blood pressure for the newborn was within normal limits. So then I'm going to get length, weight, head circumference, and chest circumference. The head circumference should be larger than the chest, since that's the largest part of the baby to come out. And then I'm going to do my general assessment or overall appearance of the baby, to make sure the baby looks okay, no trauma or bleeding actively, and then I'll begin my full assessment. So I'm going to be looking at body alignment and symmetry. The baby should be symmetrical. The baby should have good muscle tone or be flexed, and then I want to be able to note the cry. Different types of cries could indicate different problems. And then for skin, depending on the gestational age of my baby, this could be different. So the baby will have vernix, which is a cheesy, waxy substance that protects the baby in utero from the amniotic fluid. Milia, they're little white spots that are like pimples. They're normal for newborns. The lanugo, that's like a baby hair. It's temporary. It'll come out as the baby gets older, and that amount depends on gestational age as well. And then erythema toxicum would be a newborn rash. It's generally on the cheeks. It's from exposure to the outside world and things that the baby has never been exposed to. Doesn't necessarily indicate allergies yet. And then Mongolian spots, which are most common on the trunk and the bottom. You want to be sure, if you notice these, they're birthmarks, but you want to make sure you document size, color, location, because they do look like bruises sometimes. And then you want to look for petechiae, which are little red spots just from blood coming to the surface from pressure or from labor. And then we're going to look at the head. So the baby's head should be normal cephalic. We're going to look at fontanelles, and the fontanelles should be assessed when the baby's not crying, because that can increase cranial pressure, which will make them look swollen. So the anterior fontanelle should be a diamond shape, and then the posterior fontanelle is a triangle shape, and that's much smaller. Sometimes that one's harder to assess, but they should be flat. And then you want to look at the baby's head for molding, which is normal for vaginal deliveries because the sutures of the skull are not together yet. And then you want to look for cephalehematomas, which would be from trauma during the birth. It's just a blood clot under the scalp. And then you want to look for caput, and that's just normal swelling from the birth canal. And then you want to look at the baby's face for symmetry. The outer canthus should be about even with the top of the baby's ears. And some of these, if they're not quite right, could indicate possible problems of development. And then you want to look at the baby's eyes. The iris color, most babies are born with a bluish slate colored iris, and that will change as the baby gets older sometimes. So the baby's eyes do not accommodate, so you'll want to look for pearl. You want to make sure the pupils are equal, round, and equal. And then sometimes the baby will have strabismus, which is lazy eye. In most cases, it resolves on its own with no intervention, and that's normal for babies. And then you want to look at the conjunctiva, because the baby came through the birth canal, and there's lots of bacteria, so you just want to check that. And then you want to look at the baby's ears. They should be well formed and aligned properly with the rest of the face. And then for nose, you want to make sure it's patent bilaterally, since babies are nose breathers primarily. And then you want to look at the baby's mouth. You want to check the baby's palate with a gloved finger. You want to feel all the way to the palate, soft palate and hard palate. Make sure there's no openings. And then you want to check for Epstein pearls, which are just calcium collections, which normally resolve on their own and absorb back into the body. So while we're at the mouth, we can check the rooting reflex. If you rub the baby's cheek, the baby should turn its head towards your finger to root or feed. And then you should check the baby's suck reflex. The swallow you can check during feedings. And then for the baby's neck, you want to mainly check the clavicle, since they don't typically have much of a neck. You want to check for any malformations, or if the baby can move both upper extremities. And then you want to look at the baby's chest. You want to look for appearance, shape, and symmetry of the chest. And the chest rise or respiration should not look labored. And then you want to, while you're on the chest, you want to look at the baby's nipples. You want to note the size. Babies will have, male and female will have breast buds. You want to measure engorgement. Normal would be 2 to 5 millimeters, and it can just determine the development of the baby. So the baby should have, or can have, up to 15 seconds of apneic periods, but no more than 20 seconds. You want to listen to breath sounds. Crackles and wet lung sounds are normal within 24 hours of being born, because they were in fluid. And the breath rate should be 30 to 60 breaths per minute. And you want to try to assess that while the baby's resting. And you want to listen to the apical heart rate, which we did earlier in vitals, for a full minute. And you want to listen for murmurs in the heart. Those can be normal up until 24 hours. And then for the baby's abdomen, you want to inspect the baby's umbilical cord, which should be cut at this time. Babies that are older than 12 hours, you may not be able to distinguish the 2 arteries and 1 vein in the cord. But you want to make sure it's drying okay and there's no redness. And then you want to listen for bowel sounds. If the baby's had its first feeding, there should be bowel sounds. And you want to look at how the baby's voiding. So for urine and meconium, which is a tarry, normally black, it's the first sputum that the baby will have. So then moving on to genitals. For a female, you want to check for discharge, which could be completely normal. It could be a pseudo menstrual cycle, which sometimes happens when the baby's getting rid of all of the extra hormones that they got in from mom. So that's completely normal. You want to make sure the labia majora covers the clitoris. And you want to make sure you're taking off the diaper to assess. And then for the male, you want to make sure the meatus is center and not hypospatus or epispatus. And you want to palpate the scrotum for the testes to make sure they've descended. And you want to note the amount of rugae that they have on the scrotum as well. And then we'll move on to extremities. So they should have equal and bilateral movement. They should have good muscle tone. They should have 5 fingers on each hand, 10 toes total. So you want to make sure all of the fingers and toes are there, that they have good range of motion, are able to move all their extremities. And then you want to do the Ortolani test for hip dislocation. And if there is dislocation present, you want to make sure you tell the appropriate people. And then when you assess the feet, you're checking for acrocyanosis, and be sure to look for clubbing so that can be corrected early on. And then for the back and spine, you want to make sure you turn your baby over. You want to look at alignment of the spine and vertebrae, and you want to make sure there's no openings or tufts of hair or anything like that that could indicate spina bifida. And then while you're looking at the baby's back, you want to make sure the anus is patent. For this, you want to do more than just look at it. You want to rub a gloved finger across it, and it should have the wink reflex to indicate it's patent. And then you want to do the baby's reflexes. So while the baby is sitting in the crib, you want to have your hands behind and slowly drop like you're going to drop the baby, but you don't. And that's the startle reflex, so the baby should throw its arms up and seem startled. And then for tonic neck, if the baby turns its head one way, the one arm will extend and the other arm will come in like they're fencing. And then it should be the same on the other side. So for palmar, the baby should grip your finger if you put it in the palm of the baby's hand. And same with plantar. Its toes should grip your finger this time. So we went over rooting, which is with the gloved finger. The baby should turn its head towards your finger. Sucking, baby should be able to suck on your finger. Swallow, we're going to observe during feeding. And then we're going to do the stepping reflex. If you touch the baby's foot to the bed rail, for instance, the baby should pick up that foot, and same with the other side, and look like they're stepping. And then we're going to do the Bavinsky reflex, which should go away, but it's normal for newborns. You're going to want to take the foot and rub a finger up and across, and the baby's toes should flare out. And then for the trunk incurvation, you want to rub your finger down one side, and the baby should curve towards that. And then for behavioral state, you want to make sure you educate the parents on this as well. You could have deep sleep, light sleep, the baby could be drowsy, quiet alert, which is the best time to interact with the baby, and then active alert and intense crying. And you want to be sure to note which stage the baby is in for your assessment, and then make sure the baby is safe in the crib, make sure there's no questions or concerns for the parents, wash your hands, and make sure you document your findings. Thank you.